Welcome to this episode of Rattling the Bars. In the past, we have been looking at the overcrowded conditions, the COVID-19 conditions, and other conditions in the state of California. And we have also looked at the work, the activities on the ground, grassroots organizations, and their efforts to make changes in the California prison system. Joining me today to give us an update on what's happening in the state of California at the prison system is Amber Rose Howard, Executive Director of Californians United for Responsible Budget. Amber Rose, thanks for joining me.
Absolutely. Thank you for having me. Happy to be here.
Amber Rose, could you please give me a summary in relationship to what's going on in the prison system?
Sure, sure. So, right now, we're kind of in an unprecedented moment in the state of California around prisons. There are 35 state owned prisons here. We have, the people and efforts to decarcerate California prisons have moved us into a position where we have brought everyone who's incarcerated out of state back to the state of California, and been able to end those contracts. And even so, we're in a position where we're able to close prisons. CURB has been advocating for this since 2003, and in 2019, Governor Gavin Newsom announced that there would be two state-owned prison closures by 2023. So folks have definitely been keeping up the advocacy to the legislature, trying to get them to understand the criteria that should be considered, and the decarceration efforts that should continue to happen in order to close more than just two prisons. And also in the face of that is COVID-19. So our prison population declined a little because folks are not able right now to be transferred from county jail to state prisons. But also we've been, demanding releases. The death toll in California state prisons is out of control. Nobody's able to be safe. So we're really advocating for the governor to use all of his executive authority to grant releases to folks, and for the legislature to change the penal code in such a way that it would impact people retroactively so that we can get more people out of prison in order to protect public safety.
Okay, well, correct me if I'm wrong. I thought I read a letter that perhaps you had wrote recently to the state government, uh, in reference to the budget and the amount of money that was being directed to repairing and building prisons. Uh, Talk to me a little bit about that letter, why you wrote it, and what you expect from it.
We are talking about a California corrections budget that right now is $16.5 billion. This budget has increased at least a half a billion dollars every year over the past 7 years. And what we're noticing is that this is happening at the same time when prison populations are declining, and that's trending. We're continuing to decrease the population of people that we have in prisons. So it's really strange to see a corrections budget continue to increase. We know that lots of those reasons have to do with dollars going down to probation departments. In the state of California, the state is looking at the probation departments to be responsible for reentry services, which is outrageous. We know that probation is a punitive department, and they are not necessarily the best agency to help people reenter the community. But also, we're just noticing lots of funding go into prison reconstruction. There are roof replacement projects. There are projects that would try and rebuild prisons that are dilapidated, that should have been torn down long ago. And so the purpose of the letter was really to highlight, the really irresponsible and wasteful spending that we're noticing in the corrections budget, and to try and get the governor to rethink that budget, pull back those allocations that would, that are for prison expansion and construction, and also to pull back dollars that the state has granted for local county jails to increase the county jails that they have there. So really advocating for more releases instead of transferring people from facility to facility, and actually shutting down prisons, and not talking about deactivating prisons, but really shutting them down for good, and figuring out what to do with that land and in those spaces for those communities that would actually serve the community in positive ways.
Okay, we followed that story with the prisoners that were being transferred from the Southern California prison up to San Quentin and the explosion of COVID-19 cases there. What's the status of that? I hear you say that there's a lot of deaths in the prison system now. What actually is going on after that transfer, the firing of the medical examiner? Are they still inter-transferring prisoners from prison to prison, even though they're not letting people come in from county jails? And what's actually the status of COVID-19 cases in California, if you know?
Absolutely. So, the transfers are still happening, not only with folks who are incarcerated in state prisons, but CDCR staff are working at several different prisons simultaneously. So they may work at a prison one day and then work at another prison that is in close proximity to that prison another day in doing overtime or however their activities work. So we know that folks are still being transferred as a reaction to kind of reducing the amount of people who are in the prisons. The state is relying on transfers instead of releases, which is absolutely ridiculous. We already have learned that that contributed to the incredible death toll on people in California state prisons, which right now is over 200. We've had over 200 deaths of people in prison in the state of California. These people hadn't been sentenced to the death penalty. Even in this time, Governor Newsom in 2019 granted a moratorium on the death penalty. So to say that we're not going to support death by incarceration, that we're not going to kill people in this state, in state prisons, has actually been it's actually not proven to be something that the state is standing behind because of all of the deaths that we're experiencing and that people are experiencing in state prisons. Part of the issue also is that there's been lots of dollars thrown at protective equipment for staff to use, and staff are not complying with that. We have staff that are just not willing to protect one another, and even further, not willing to protect the people that are incarcerated. Also, folks who are incarcerated who may have received some protective equipment, that doesn't help. Wearing a mask doesn't help when you're in such close quarters with other folks. There's no such thing as social distancing in California prisons, as we're still overcrowded. The federal government mandated that we get our overall population reduced to 137.5% of the design capacity. But again, that's overall. So you've got some prisons that are down to under 100% of capacity, and other prisons that are still over 100% of their design capacity. So since that's not a per facility requirement, we're still seeing overcrowded prisons, and we're still seeing spaces where folks are just not able to be kept safe from COVID-19. And I think what the public should really understand about that is that impacts the public response to COVID-19. As long as folks are getting sick inside and needing care, that still contributes to the overcrowded hospitals that people are experiencing on the outside. So it's really just bad. It's a public health disaster all the way around.
Yeah, now it was my understanding, and I could be wrong, that elderly prisoners were supposed to be released, at least there was a public demand that elderly prisoners and prisoners with health issues get released. Who got released? Did anybody get released at all? Uh,
We'd love to see that. CURB and other organizations have been working on codifying our elder parole process so that more elders are released. In 2020 or 2019, we were able to push for the law to be codified so that requirements for elder parole are changed. Whereas before, someone had to be 60 years of age and have served 25 years in prison. We were able to reduce those requirements to say that someone needed to be 50 years old and have served 15 years or 20 years in prison. And so with those changes, we're still not seeing the elder parole program used to its full capacity. We're still not seeing releases happen in the masses that they should be. And I think that's completely CDCR's fault. And I think the administration and the legislature have to take responsibility to pressure CDCR to release our elders. Following COVID guidelines, and what we've heard, across the nation, is that elders are most vulnerable to this disease. And so it's irresponsible for the state not to take a look at all of the elders who are incarcerated across the 35 state prisons and grant them releases. And we're talking not to carve folks out. We're talking release folks regardless of conviction type or their sentence. And so, we're still in a struggle and a battle with pushing the state to do that.
mm. Now, I think, and I'm going to bounce back to your letter a minute. I think you mentioned something just a few minutes ago about uh, putting some of that budget money into community wraparound services. What kind of wraparound services, support services, are you suggesting would make the community safer?
So we know that when folks are houseless, it increases their chances of coming into contact with law enforcement, with police. For some reason across the nation, and especially in the state of California, houselessness is criminalized. So people who are living in the streets at the irresponsibility of the state to provide better housing come into contact with police officers, are arrested, and put into county jails. All kinds of charges could happen from there because police control the narrative. So, one of the main things that we could do with that justice reinvestment is provide permanent, safe, and secure housing for people so that they are not having to live in the streets and they can reduce their encounters with law enforcement. Other things that people need is health and wellness. Folks don't have access to physical health care to care for their bodies and to remain healthy. Folks don't have access to mental wellness, which I think is a huge contributor to the incarcerated population. When folks don't have those kinds of services, and we know that Black, Brown, and Indigenous poor folks are the folks who are most disproportionately impacted by, to the lack of wellness services, those are the folks that we're seeing incarcerated. And I think it's also important to make sure that folks have access to food and education, and folks have access to other kinds of supportive services that would make a community united and that would make a community well. You're less likely to harm one another when folks are not in crisis and not in need, and when folks have opportunities to socialize with one another in healthy ways. And when folks have that opportunities, they're more likely to take responsibility for one another's safety. And so those are the types of things that we're calling for the Justice Reinvestment to fund, which we know would make communities safer. It's happened before. Pre-Reagan era, we had community hospitals. We had spaces where folks were able to get mental health treatment. And as those buildings started to be taken down, we saw an immediate shift into incarceration, and folks who then had mental health issues were incarcerated rather than receiving treatment. And I think another thing to point out there is that when you look at affluent white communities, communities who don't have Black, Brown, Latinx poor folks there, I think they do get those resources when they come into contact with problematic substance use or when they have mental health issues. They are given the opportunity to be treated and not incarcerated. And so we're saying this justice reinvestment could give us the same exact options for public safety. The communities that have the less police seem to be the safest communities, which are the white affluent communities. If police made communities safer, we would see the most police there. But instead, we see them in our communities. So these are the kinds of things that we're calling for.
Mm. So now you said earlier, obviously y'all had passed different laws that that are not being recognized that would help decrease the population. What is it that the public can do to push this forward, to support the effort, and to, I mean, is there any kind of way in which they could sanction people that's not supporting this effort?
Absolutely. I think that people have to be politicized. Politics are not something that most, especially Black communities get interested in. And I think that's well within our right. I think that we're not wrong for thinking that way because historically governments have failed us. Governments have not showed up for us. We won voting rights and they slowly broke them down over time, right? We get involved in politics and policies don't go our way. But I think that we can't give up. I think that people should recognize that we have the power. The power is truly in the people's hands. So folks need to be involved in the political systems. Folks have to be advocating to their local legislators about the changes that we want to see. Folks have to get engaged in the budget process so that we're calling for that justice reinvestment. And groups like CURB is here to help folks gain those skills and be educated around those processes so that we can show up. I think that there are several bills on the table this year in the state of California. Last year we passed, monumental Racial Justice Act that would allow folks the opportunity to challenge racism that shows up in courts. This year we're calling to make that retroactive. There are a few bills on the table that we're calling to make retroactive, some of them addressing felony murder special circumstances, which we know impact Black and Brown people disproportionately. So we need the power of the people on the ground to be calling into the legislature, calling into the governor's administration to make it very clear that we need these policies to pass. In the moment of COVID, we know that the legislator has shifted priorities, and because of this kind of constant fear of too much justice that we see all around the country, folks are not willing to prioritize criminal justice reform. So we need the people to be engaged so that they understand this is the most important priority that we could have, shifting spending away from caging people and actually into building up the infrastructure of our communities.
Mhm. But, why, I mean, there's certainly a lot of fear all the time about prisoners coming home, return to the community. Why should the public uh, be concerned? Why should they be involved? I mean, what's in it for them?
Right on. So, I think what we have to realize is that in the state of California, at least 70% of people are impacted by felony convictions and incarceration. If folks had themselves not been incarcerated, most of us are in contact with a loved one, a brother, sister, father, someone in our immediate family, mothers who are incarcerated. So, when we actually think about it in the grand scheme, this touches our lives very, very directly. And so I think that people what's happening now is that we're shifting the narrative so that it's very clear that many of us are impacted, and we're building a community that would support people who are impacted. Having such close relationship with incarceration and the carceral system is very stigmatized. So lots of folks, I think, have held back from being involved in criminal justice reform because of that stigmatization. Folks don't want to admit that they are system impacted. So I think it's very important that we talk about that statistic. And then again, also understanding that we can't continue to freeze people in their worst moment. I am 35 years old now, and at the age of 18 was convicted of a serious violent offense here in the state of California. And, I can tell you, and anyone that knows me can tell you that I'm not the same person that I was at 18, or at 35 that I was at 18. And so when we look over our own individual lives, we have to have that understanding and realize that, it's in our best interest and it's in the interest of public health to get people released, to close prisons, and to reinvest funding into resources in the community that keep people away from crisis in the first place.
Okay, let me just switch for a minute here. Vice President Harris, um, to the best of your knowledge, you're there on the ground. I'm here in Maryland. Around the country, we hear different things about her role in increasing the prison population and bringing some of those draconian measures in effect. What's your take on her? And did she do any of this stuff that we suspect her of? And is she going to try to undo it when she's up on the federal level?
Yikes.
I had to ask. You know.
So I think it's always funny when I hear this question because yes, things are absolutely true that folks hear about Kamala Harris. When she was, a prosecutor here in the state of California and in charge, she made sure that folks were incarcerated for things for reasons, problematic substance use, for truancies, for things that actually you could very clearly recognize people needed resources and not to be incarcerated. But Kamala Harris is, we here like to say that district attorneys and prosecutors are cops. She's a police officer. And so it was her job to make sure that people were being incarcerated all of the time. So she's absolutely responsible for some of the turmoil and the chaos that people are experiencing because of the carceral system here in the state of California. We'd like to think that now that especially Black folks helped serve her right into that vice president seat, that she would reverse some of those harms at the federal level and help influence the state of California and other states to reverse some of those carceral harms. But time and time again, we have been disappointed by politicians when they get into higher spaces. So I think it's just really going to take lots of organizing at the ground level and for communities to hold her accountable to those policies. We've already seen, dangers coming out of the Biden-Harris administration, and we haven't seen Kamala Harris step up to really push back or to speak out for the people on what should be happening. So I think at best we can just continue to organize and like cross our fingers or pray or light candles or or do whatever to help, to help push her to be accountable to the people and to correct and reverse some of the harms that she's caused.
Okay, so is there any final thoughts that you want to share with the public um, in general?
Just that, we're in a moment where all over the country, folks are calling to defund the police, which I think folks have to have an understanding. When we're talking about defund the police, we're talking about police at every stage. We're talking about police in the communities, police at county jails, police at state prisons, police in district attorney's office. We're seeing their budgets overflowing with resources, and they're all used to incarcerate Black, Brown, Indigenous, poor folks. So when we say defund the police, we're saying that they have too many resources and are responsible for things that they actually can't serve properly. The call for police is to say that they're here to protect and serve, but I think most of our experiences in communities like mine are that they've harmed. So I think that we need to continue to make that call to shift those budgets and for budget for justice reinvestments. And then also I think that when we're thinking about racial justice and the call for racial justice, we have to learn that part of how we're going to get that racial justice is in justice reinvestment. Budgets are a statement about our values. Budgets tell the public what the state thinks is most important. And as long as we're continuing to increase the carceral budgets at the state and local levels, they're telling us that our lives don't matter. They're telling us that our bodies don't matter and that our communities don't matter. So I think one value that we all share is that families should stay together. And so I think the work that we're doing and what we're calling for and trying to help organize people around is to keep families together, to strengthen communities, keep people out of crisis, and really it's a benefit for everyone. It's a public health benefit for everyone. Folks should really think about incarceration as a public health crisis. It's a public health issue. And I think when we think about it that way, we drum up a little bit more support and people are a little bit more excited about fighting for releases, for prison closures, and for that justice reinvestment.
Okay, Amber Rose, thank you. Thanks for joining me.
Awesome. Thank you so much for having me.
Okay, and thank you for joining this episode of Rattling the Bars. This is a special request coming from me because we bring you programming that shines the light on the prison industrial complex and the problems that are going on behind the walls. We cannot continue to do that without public support. We need to have donations made uh, in the name of Rattling the Bars or the Real News Network itself. Uh, Go to the donate button and donate to the real news slash rattlinthebars.com, whatever that information is down there. Uh, we cannot continue programming without your support. Thank you.